Hi, Alexis Hythe here. Thank you for joining myself, Eileen, and Nicholas as we present this presentation to you all. Hope you enjoy. Floating is often unavoidable and it's used as a solution to deal with staffing and census issues within a hospital. But Bitanga noted in her 2018 article that it is associated with negative patient outcomes, some more severe than others, like in the event that you have a nurse floating from a medical surgical unit to an ICU unit or an emergency department area. This can result in dangerous outcomes for patients, and then also it can result in just negative patient experiences in general because they can become aware of that nurse being anxious and the fact that they're not familiar with the environment that they are in. So this definitely poses safety concerns, and it's just truly not a sustainable option to dealing with staffing issues because often nurses are not satisfied with this arrangement, which results in a high turnover rate, and that just costs the hospital more money when these nurses have to be replaced. There are a number of factors that can contribute to this issue. In essence, there are two sides of those factors. There are those factors that are related to hospitals being short staffed at their baseline most times, and then also factors such as there being a low census during certain seasons, and staff needing to be floated to ensure that they get their appropriate hours, and those are just kind of factors that kind of are what they are to an extent for most hospitals. And then there are the factors that are related to the ineffective training of nurses for different departments before they are floated. The fact that not all hospitals actually hire for float pool nurses. And, oftentimes hospitals are just trying to get nurses in the door so fast that there's not an option for a hospital-wide orientation where you float through, departments aside from your own. And so there's those deficiencies in the orientation process. And then, just the hospitals really just trying to save money and not offering those options. Um, so those are some of the contributing factors. Leadership most certainly has an impact on this issue from managers on up to the executive leadership. And so we'll just kind of start off with managers. Um, Managers are responsible for making the schedule, but oftentimes when you report for your shift, it's the charge nurse who's informing you that you're actually going to be floating. And so managers often aren't, directly involved when that float is happening because it's often happening because of a new staffing change or issue. Um, and so we do find that managers are more democratic and open in their approach to listening to our complaints and concerns about floating. But when the information is passed up to executive leadership, we find more of an autocratic approach where changes are not actually made in the form of policies. Um, and then also just there being an issue sometimes where there's not enough disciplinary action for repetitive call outs that continue to disrupt staffing. So those are definitely some ways that leadership impacts this issue.
Hi, my name is Eileen Dow. I'm a family nurse practitioner student at Francis Marion University. Interprofessional teams and communication are vital for maintaining patient safety. One of the most important interprofessional collaboration is between physicians and nurses. It is an important aspect of delivering safe patient care. However, without knowing each other, the communication between a physician and a nurse may be reduced, constraining their collaboration. A rapport with mutual respect is usually created after working together for a long period of time, which allows the physicians and the nurses to learn each other's methods and strengths, something that nurses who float to several units at different intervals cannot build. Therefore, it could lead to poor patient outcomes. The physician may also view the nurse's knowledge as limited when the nurses are unaccustomed to the unit's procedures. Many facets compose informatics, but the one aspect necessary for safe transition of patient care is the patient's electronic medical record, their EMR. The patient's EMR contains all their pertinent medical information, including medical history and current medications, and is easily accessible by the medical team involved in their care, including a float nurse who is unacquainted with the patient. Another way that informatics is helpful to the nurse who may be unskilled in the unit they were floated to is their ability to rapidly look up unit-specific evidence-based practices. They could also quickly look up medications they're not used to administrating or conditions they're unsure how to assess. Health informatics is also essential for examining staff tracking and workflow, which is how an organization can keep track of the patient-nurse ratio and ensure that nurses are not understaffed, minimizing the need to float nurses to unfamiliar units. The constant shortage of nurses and the variance in patient census make it inevitable to float nurses out of their units. Although it may be a cost-effective solution for organizations to cover vacancies, patient care becomes deficient if the nurse lacks in skill sets. One of the interventions organizations could implement is having an assigned float pool that consists of nurses who volunteer to float, decreasing the anxiety of the nurses who would otherwise unknowingly and reluctantly be assigned to float. Another intervention is the proper orientation to an unfamiliar unit. Nurses orient within different units while having a preceptor. This way, the nurses familiarize themselves with the layout and the staff before working on that unit. This also allows for the development of the buddy system, where the float nurse feels comfortable asking an experienced nurse for help if needed. The final intervention is a sheet with specific unit information. The tip sheet includes location of various supplies, procedures and protocols, and contact number.
My name is Nick Bart, and I am a family nurse practitioner student at Francis Marion. From an ethical perspective, I'm going to focus on a designated float pool. And one of the biggest questions here is what is important to the organization? Many times, these healthcare organizations do turn a profit, and so they have to decide whether or not they want to continue to make money or if they want to improve patient outcomes and increase employee satisfaction. Float pool nurses typically do make more money than core staff nurses, and so this is going to cost the hospital more to orient them. They also require more competency training and continuing education training because they are required to work in more areas and more specialties. And so this is one of the biggest ethical considerations of the organization when they're implementing a float pool. According to Aurora in 2018, Lewin's change theory involves an organization unfreezing an undesirable behavior, changing that, and then refreezing the action that you do want. In terms of creating a float pool, we want to unfreeze floating nurses that don't want to be floated. We then want to collaborate between administration, nursing, physicians, become more organization centric instead of focusing so much on the unit, which can be difficult, in creating a positive float experience for this float pool, making sure they have everything they need, the resources, and know who to go to with questions. We then want to refreeze this and determine whether or not we've made a difference. The idea of implementing a float pool to limit the floating of core staff nurses does not necessarily require a policy change. This would be more of a recruiting initiative that would require leadership to acquire versatile nurses that have a wide range of experience and expertise. Not only would this improve patient outcomes because you have experienced nurses covering staff needs, but overall employee satisfaction would increase because core staff would not be required to float as much. As future nurse practitioners, we can't directly affect the nursing shortage that we face today, but we can do a few things to ensure that we are efficiently treating and then discharging patients home in a timely manner. The first is simply communicating with the nurse about the game plan, short term and long term, for the patient. Secondly, we need to be efficiently ordering things that are relevant and then clustering those orders so that we deliver care in a timely manner. Lastly, we need to be empathetic towards nurses. We were all there once. We need to make sure that they have what they need. If they do have questions, we're answering them with good rationales. Thank you guys for listening today.